Hi guys, Glasgow here. Welcome back to my channel. Welcome back, my friends, to my 50th, that's 50th video. Man, I've been putting up a lot of videos here lately. Pretty big for about a month's long duration. I hope you've enjoyed my videos. And if you haven't seen them all, go back and look. Go ahead and look at them. Help yourself. For my 50th video, I have yet once again donned the very first black mask I wore. Yep, that's the original. It's back. So, I've been thinking a while of what I wanted to do for my 50th video, and I felt it had to be something important. And I decided something that is important to me. Something I've been working on since early 2000, when I worked back at the factory. And that is healthcare, nationwide healthcare. And I made the final alterations to it back in 2014, put it to paper, made all the finishing touches. Could probably use a few good tweaks still. Especially, this would be something to totally replace Obamacare. This is something I would encourage anyone who watches this, encourages to go to President-elect Donald Trump. I was going to make a video of this before the election, but I didn't want Hillary to get a hold of it and start touting this about it as her fucking idea. So anyway, this is a plan that's cheaper than Obamacare, actually fixes the problem. So, let's get into it. This program can be either a total health plan mandate nationwide or be used as a government alternative to the private sector as a challenger to keep their premium costs down. This plan actually tackles all three things you need to do in order to make healthcare truly affordable. That is, plan/funding costs, medical treatment costs, and pharmaceutical costs. This is something the Democrats have no damn clue about, as we've seen with the Affordable Care Act / Obamacare, or even with single player. And to be fair, even some of the Republicans don't know what they're talking about either. What this does here, this plan does, is it's actually doesn't encourage single payer with what Mr. Trump and some of the other Republicans have said are true. By breaking down the state borders, you do encourage competition. But having this as the government program plan will make even more competition and make their premiums drop even more. Because if you got more people on the government program than the private sector, that doesn't leave a lot for them to do, so they're going to want to try and compete. So, this competes with the three big problems again. Like I said, costs of the plan, medical treatment costs, and medicine costs. And you're going to see that as I go through here. Okay. First, we're going to tackle the funding, and actually call this plan the True Total Health Care for All. Actually, named it after my state, but since you don't know where I live, my state, we'll just call it that. So for funding, charge all full-time working citizens a monthly premium of $40 per adult, ages 18 to 65 years of age. All part-time workers are charged $20 a month. This premium is divided up per paycheck per month. For example, if you have a bi-weekly, you get charged $20 per paycheck, pre-tax per pay period. All children ages 0 to 10 are $5 per month, and all children 11 to 18 are $10 a month. And these are considered added dependents. Adults 65 and over that have lived in the United States for a minimum of 10 years are free of charge. If an adult 65 and over has not lived in the United States for a minimum of 10 years, must pay $10 a month until the 10-year minimum is met. Also, in addition, a 1 cent per dollar tax will be added to all sales tax in each state. These funds will go into a state health fund that cannot be used for any other reason than to pay for healthcare or for legal citizens and nothing else. This cannot be overridden by any legislation, local, state, or federal. The only way this can be changed is by a majority vote of over 50% by the registered voters of the nation in an election. No amendments or additions may be added to this law without, again, over 50% citizen vote to add the amendment or addition. No political party can ever change this. And that's the key. You can't have it changed so easily with something that's important. Now, on some of these points, $40 is cheaper than what most people pay right now. Cheaper than what I pay. So it's a fair system. It's fair pay cost for what you get. And you're going to get a lot, as you'll find out here soon. Also covers children. Children still have to be paid, and it's a small fee. It's an extra $5. The reason for the 65 and over being pretty much free, as long as they've been here 10 years. If you've been here your whole life, in my opinion, by the time you hit 65, you've paid your debt to society. You've paid enough to the government. It's time to be given something back as appreciation by the nation. Now, this does, of course, will raise a problem, which we may have to add to this a little later, is it could encourage a lot of immigration to come in who are just old to make the 10-year cap, and then, of course, take advantage of medication. But, like I said, it's something we could work on. I'm not quite sure how to fairly put that in here yet. Like I said, I would leave that up to, say, Mr. Trump. Let's just go President Trump. And I would believe they would do pretty good. So next, what coverage do you get for all this? Well, this health care covers all non-cosmetic medical health expenses 100% after a $10 copay. Well, what the fuck? I mean, Jesus Christ, 100% after a $10 copay. Who can't afford $10? The cosmetic medical is considered all medical expenses that do not relate to preventative illness treating or life-threatening illnesses. For example, sorry people, breast augmentation, penis enhancements, general plastic surgery not related to an illness, sex changes, that stuff. Just those as an example. We're not going to cover those. And of course, this coverage would carry over to any state or country that the registered legal citizen of the United States would go to. We'd cover that too. So, covered 100%, except in that point, it's a $25 copay. Now, for the medication. All medication needed for treatment for illness or prevention of illness shall be covered 100% after $5 copay per prescription. If a medication cost is under $5, the med is paid 100%. No medication shall be paid for that does not contribute to treatment of illness or prevention of illness. The only exception shall be for birth control up until the age of 21, and then birth control shall only be paid for by the should a physician that recommends that the medication is used for a true medical reason. Now, I know, like, out there, sometimes birth control is used to help women with certain conditions. Then that would be paid for. I'm amazed that almost the only gripe I've ever gotten out of this plan of all the people I've seen who like it is that part of the plan about the contraception, about the birth control pills. By the time it's going to be $5 a month, fucking folks. Come on. You can afford $5 a month. For payment reimbursement, any facility that treats a legal citizen of the United States at their facility receive payment reimbursement of services rendered to said patient or client within 30 days or less after the receipt of the bill to the state. Payment will be the actual cost of said procedure / service plus 20%, and not necessarily the cost said facility charges. So if a facility charges $200 for a service that actually costs $50 to perform, the facility will receive $60 for the service. That's the $50 times 20%, which is $10. So $50 plus $10 equals $60. This will make the bill paid in full, and the facility may not go after the patient/client covered by this health care for restitutions for the remaining balances. Now, this part's in here because this is part of medical treatment. It has become, there is a book out there, if you know medical codes, it's called the ICD-9 code and now the ICD-910, where they have lists of items, and they have 3 price points for each thing that's wrong with you. You have Medicaid, Medicaid/Medicare, price, and then 2 others. It's very technical, so I don't want to use it up on here all the time. But using that alone would give you a price point. We have some places in here, like especially California, Jesus, charging you $14,000 for a procedure that costs $1,200. That's bullshit. That's way overcharging. And that's just not California. There's a lot of hospitals that do this. There's a lot of physicians' offices that do this. By doing this cuts back on that. It cuts down the cost of healthcare. By doing this, you cut back on the cost of healthcare. And how you make this up is by just the sheer volume of people coming. By having this, more people who are actually sick will not go to the doctor. A lot of people won't go to the doctor now because they just can't afford to. And a lot of people go make it because of how much the medical expenses cost. Think about it. If you have cancer, how much does that cost a person? Most people lose their homes when they have treatment for cancer. This now covers that. Or a child that has very, very sick. Look at the parents who work multiple jobs trying to make sure their child is covered. This now covers that. Pre-existing conditions. Notice I don't say anything about pre-existing conditions because it's already covered. It doesn't matter if you have a pre-existing condition. If it's treating your illness, you're going to get covered for it. Let's continue and we'll talk more about it. Let's see. Payment the patient/client shall receive notification about said bill. If the patient refutes said services were done, for example fraud, then payment will not be given to the facility and payment of said services will be refunded to the state by the facility if they ever received it. Next, pharmaceuticals. Again, all medication within the United States shall not cost more than 25% of the actual cost to make it from the pharmacy. For example, the medication costs $100 to manufacture. Shall not cost more than $125. $100 times 25% is $25. So 100 plus 100 plus $25 is $125. Any manufacturer or seller must comply with this law. If they don't, then you just don't sell your shit here. We get our stuff from Canada. We can get it from an outside place. This is where a lot of the problems are. By laws that were passed, medicines can charge whatever the fuck they want for it. You can charge something that costs you $9 to make. They want to charge you $100 a pill. Fuck that. That's ridiculous. It's called greed. This ends greed. And of course, this portion of the law cannot be changed without the 55% vote and all that. And of course, again, not affected by party or legislation. All has to be done vote by the citizens. Next is the medical services. Same thing with medical services, basically. No medical services shall be granted by the hospital clinic within the states shall charge more than 25% above the actual cost of said service. So, this again controls cost. Can't do more than 25% of what it actually costs. That's 25% profit of what it actually costs you to do. So you're still making 20 to 25% of a profit. There's no excuse. You can't say you ain't making any fucking money. Like examples of the pharmaceuticals. Well, we need all that extra for all the research we did. Bullshit. You got like a 17-year fucking patent to bring the exclusivity with a fucking brand name. Where's it 12 years? 12 to 17 years. Don't fucking matter. Then you can license that shit out. So you're making fucking hand over fist. So don't give me that shit. And again with claims of service, the person would, sign and do a thumbprint on a receipt, And that's how we curb down on fraud. And it also helps people take care of their bill. And we make sure that they see the itemized bill. Because it's time for people to be responsible, folks. You have to be responsible with this. This breaks down to where instead of just being one big national, each state would be responsible for their own funds. So you'd have 50 places, in each state. So each state concentrates locally. All those funds go locally into that account, and this transfers if you want to move to another state. So this puts it down to the local state level, to the funds, taken care of. It makes for quicker reimbursement than if you're, say, going through Medicaid, where it's still DC. So this creates more jobs. People are paid. It's self-sustaining. My figures were quite a few $1 billion per month, and both. Well, let me say, for example, in my state, the funds alone, I'd make almost, just for the people who are working. This does not include the 1 cent sales tax, per dollar sales tax. Just the people working alone, almost $2 billion a month. That's enough fucking money to take care of people in the state, medical wise, if they were on this plan. So even if you're not on the plan, everyone pays. And it's just 1 cent per dollar. It's an extra penny per fucking dollar, folks. So that $10 item is going to cost you an extra 10 cents. It's worth it. If anything major happens to you, you can be covered. Say you get hit by a fucking truck and your insurance company doesn't take care of it, you're still covered. It's fair. The people who pay into this get the better benefit because they get to have more of an option. They get to choose whether they go. It'll keep all the private sectors keeping their shit down. They're trying to compete with this. They have to make their stuff look more appealing. So this covers a self-funding. Now everyone isn't going to cost them almost $1,000, or between $500 to $1,000 per fucking month. Just going to cost you $40 by yourself. You've got a family, okay, see, 40, 80, 85, 95, $95 for 2 adults and 2 average children. $100, folks. You've gone from $700 to $1,000 a month for a family of 2 plus 2 children, down to fucking $100. That's more money in your fucking pocket. It gives you more money to put that towards your bills, for a vacation. It makes you have room to breathe. Now you're not just working to pay for fucking insurance. You're not going, I don't know how many people I've known, even in my current job, who just work, and all that money they make, the majority of all the money they make, goes to paying fucking insurance. So you're working for nothing. I think this is a bit better of a deal. I didn't go through the whole thing because a lot of it repeats because of the same process. I just wanted to hammer that home. I have examples here of what is covered, what isn't covered. I'm not going to go over this with you on this video. But look, folks. The ACA audit is like how many fucking pages? This fucking tall. Or what, like the example. A headache. You know what this is? Look. 4. Count them. 1, 2, 3, 4 fucking pages. With slightly bigger font. And a page worth of fucking examples in the fucking bill itself of what's covered and what's not, to help differentiate between what's cosmetic and non-cosmetic. I mean, non-cosmetic and cosmetic. For what will be covered and what will not be covered. Covers fucking fraud. There wasn't anything for prison time and stuff like that because it's already covered under fraud. It'd be covered just like under Medicaid, Medicaid, or any other kind of insurance fraud. 4 fucking pages, folks. Okay? It's that fucking simple. Got all you people out there saying, oh, it ain't that gonna be that fucking simple. Yeah, it is. It can't be that fucking simple. It's called common sense. So, what do you think? Everyone I've told here that I know like it. I want to know what you think. Comment. Get this to President Trump, Vice President Pence, to your local legislator. Bring them to me. I'll be happy to explain it to them. And so, like I said, and like or dislike, comment, and subscribe. Doesn't cost you anything, folks, to do any of that. You know, like, dislike, comment, and subscribe. It's all free. I want to know what you thought. What do you think of the plan? What do you think of some of my other videos? Go check out my other videos. 50 videos. I plan on being here for quite some more. I'm enjoying doing these for you. I enjoy sharing my ideas with you. I hope I encourage you to think. Talk to me. Love to hear what you think. Let's have a discussion. Thank you for being here with me through 50 videos. I enjoy it. I'm more up to 190 viewings. Before number 49 and 50. And I hope to hear many more. I hope we have good ventures together. Come back again. And I'll have more videos for you. So until then, you guys take care. And as always, I'll see you next time.